of the coated latex beads to each of the 3 encircled areas on the slide. Note that the suspension is concentrated enough to produce a milky appearance on the background. Now you add a few drops of the unknown sample that you're interested in testing, but you will also need to use one circled area for a negative control solution that contains no antigen, and another for a positive control solution that contains the antigen of interest. Next, the slide is gently rocked or swirled to mix the beads with the test solutions, and the samples containing the antigen of interest will begin to agglutinate the beads. This will produce the appearance of visible clumps, and the solution itself will turn from milky in appearance to clear and transparent. This transition should occur in the circle with the positive control. If the antigen is present in the unknown sample, then it will form a particle. However, in this example, latex beads are used, and they have been prepared so that the antigen of interest coats their surfaces, and they are concentrated enough to produce a visible, milky suspension. To measure antibodies against the antigen, the particles are added to the wells of a 96-well microtiter plate, and then sera taken from different patients are added to the wells in the first column. Twofold dilutions of the sera are prepared in the rows, and then a known negative and positive control serum are added in the last 2 columns. When the plate is allowed to incubate at room temperature, the wells containing the negative control serum remain unchanged. The wells containing the positive control serum have developed a visible button at the bottom of the wells, and the solution in those wells has changed from milky to clear. So what accounts for the appearance of the positive wells? And what accounts for the lack of change in the negative wells? To understand what's going on, let's take a microscopic look at the negative and positive wells to see what is happening in each case. When there's no antibody in the well with the beads, they remain in suspension, giving the well a milky appearance. However, when specific antibody is present, it binds to and cross-links the beads. This causes the beads to clump and to form large aggregates that sink to the bottom of the round bottom wells. They make the suspension clear as they sink instead of milky, and the aggregates settle into a pellet or a button which forms at the bottom of the well. So you will see the button at the bottom of any well that has enough specific antibody in it to precipitate the beads. But when the antibody is diluted out, the button no longer appears. The patient's antibody titer is the last dilution of serum that produces a button. But how do we explain the absence of a button in the most concentrated wells of the serum with the highest titer shown by the orange arrow? Imagine a well that has many more antibody molecules in it than beads. In this situation, the beads will be completely coated with antibody, and there will be no possibility of cross-linking and precipitation. This phenomenon, which is referred to as a prozone, sometimes occurs in cases of syphilis. The standard screening test for syphilis is an agglutination assay in which undiluted serum is added to beads coated with the antigen cardiolipin. In secondary syphilis, the antibody titers are sometimes so high that the test exhibits a prozone and is falsely negative. So how do you think you could overcome this potential problem and make the correct laboratory diagnosis? Did you think of diluting the serum and then retesting it? By diluting the antibody in this situation, the amounts of antibody and antigen are closer to being equivalent with one another. Then the conditions for cross-linking can exist. Now when cross-linking occurs, a precipitate forms, and the button develops at the bottom of the tube, indicating a positive test. Prepared and tested. To better understand how this assay is done, let's take a closer look at what happens in one of the wells of this assay plate. To perform the assay, the wells of the plate are coated with the antigen of interest. For commercial tests, this would be done by the manufacturer of the assay. To begin testing, The wells are filled with dilutions of the patient's serum. If antibodies against the antigen are present, they will bind to the antigen fixed to the bottom of the wells, but only antigen-specific antibodies will bind to the wells. The wells are then washed out to remove all unbound antibodies. Next, a solution of an animal antibody against human antibodies is added. This second antibody is covalently conjugated to an enzyme. The wells are washed again, this time to remove any unbound enzyme-conjugated antibody. Finally, a solution of a colorogenic enzyme substrate is added. The interaction of the substrate with the enzyme on the second antibody generates visible color. The development of color in the wells with a specific antibody can be seen with the naked eye or quantified with an electronic plate reader. The reaction is less intense as the serum is diluted and the amount of antibody captured in the wells decreases. The titer is the highest dilution with definite color.